We are building bridges between us and the healthcare system, and catching the issues early that patients are experiencing. We can provide care quicker, it's more accessible, and provide preventative care for the patients too. And again, the NHS 10-year plan recognises pharmacies and what we have to offer in reducing the waiting lists that we experience at GPs and hospitals, and boosting access for the patients closer to their home, alleviating pressure on all sectors.
Hello, everybody. Welcome again to Chain Reaction Podcast. As always, we talk in logistics. And today we have a special guest. We have Natasha Jones, who is the head of operations at GMG Pharmacy. So this is a very specific sector that is quite interesting for us to explore, that requires quite a lot of specificities, and we'd like to discuss some of the elements around that. So welcome, Natasha. Thank you for joining us.
Thank you for having me.
I'm starting pretty much all of my podcasts. I'm starting with the question of how you ended up in logistics, and in particular in your case, it's quite interesting. Would be to explore a little bit more, especially for the younger generations. I don't think that these days people dream about logistics. I don't think they ever had, but I know a friend who wanted to be a truck driver. That's pretty much as far as the wishes go. But how did you end up in logistics? How come you got into that space, and how are you finding it so far?
So 8 years ago, I started in pharmacy. I just worked at the bottom as a dispenser, and then throughout the years have found myself going up with promotions, and especially during COVID, that was the point for me where I got into the operational side of pharmacy, because we were able to manage our clinics, the COVID clinics that we had. We had 4 at the time, but we worked closely with other stakeholders to provide operations outside of the pharmacy. So I was operating the 4 pharmacies which we had at that time, as well as roving models. We had 2 buses and pop-up clinics, so arranging the operations for that to ensure that remains compliant and operational. And then I've just worked my way up now. So now we have 10 branches in Suffolk and North East Essex, as well as Wiltshire, and continuing to grow. I like the pressure. It's challenging.
Well, that's interesting. It's kind of the personal perspective. On one hand, well, job is a job. I mean, kind of pays the bills on one hand, but on the other hand, it's interesting where people finding something that is personal. You said you like the pressure. Many people hate the pressure. So how do you find the pressure in that space? And is that what excites you? Is that what keeps you on your toes, or is that like one of the necessary evils?
I think it definitely helps me keep on my toes. I'm always learning something new and how to, challenge myself more. I'm always developing myself. But it's nice that at the end of it, there's a nice end goal. We're helping a lot of people, with treatments and services. So there's an end goal at that. You can see the reward.
Boy, okay. It's very interesting. So, to give viewers a perspective about the business. So you mentioned that you have 10 pharmacies, and you obviously do more than just simply prescription pharmaceuticals and over the counter stuff. You actually do some other things as well as the home delivery. So can you maybe describe a little bit about the setup of the business, as kind of what you do as more of a general retailer rather than just a pure pharmacy business? That's my understanding.
Yes, we have the dispensing side of the pharmacy, where we do the prescription medications which come from the GP and other healthcare providers. We've then got over-the-counter medication retail, so that's all of the medication that you can only get from the pharmacy. Then also we have the general retail space where we'll keep with the more cosmetics products, but not too much of that. We provide services, NHS and private, and home delivery, as well as one of our services.
Okay. Well, thank you. So that hopefully that gives the viewers the context of our discussion today. And now I'd like to explore the area. So you talked about the pressure. You talked about COVID.
Yeah.
I think if it goes under the overall banner of disruptions and external events that kind kind of not undermine, but necessarily kind of drive you into kind of firefighting mode and so forth. So can you maybe elaborate or just give a bit of experience on both the COVID items or COVID side of things, as well as more recent ones, and kind of which ones you faced, which ones, how you dealt with them, what are the implications, the impacts, because that's a very, very interesting area and is quite close to everybody's hearts, especially these days.
Yeah, so with the global, the issues that we've received, we need to be a bit more forward planning, I'd say, and a lot more resilient. So, so as a whole, there is no central procurement for NHS. Us as contractors of the pharmacy, we need to deal with this ourselves, which can be quite challenging sometimes. And recent global events have increased focus on forward planning, so stockpiling key items and utilising our warehouse space and shifting towards multi-supplier procurement. The supply demand obviously is in Europe, Asia, and the US, so we have to stay flexible with that, especially with the rising tariffs and the unpredictable pricing which we're seeing. But we've got branch-to-branch redistribution implemented, which will help us maintain local service continuity.
It's very interesting because I mean, obviously it's not fashion, so you never know who's going to get sick with what and what kind of medicine they will require. I
Yeah,
appreciate that on more of a kind of the general retail side of things, people all need, I don't know, drinks and sandwiches, or they all need paracetamol.
yeah.
But especially if you go to the prescription drugs, you never know what the demand is going to look like tomorrow. So it's not necessarily season related. So how do you address that completely different set of products that you're working with? Like some of them are a bit more, let's call it vanilla or mainstream and a bit of a steady flow. Some of them could be highly seasonal. Let's say it's beverages, for example, that are hot in the summer but low in the winter, and a
Yeah.
completely spiky things that could be related to hay fevers or some infections and pandemics for that matter.
So some things we can forward plan with recent trends and also our experience and also our data that we have. However, there's some shortages that we can't predict at all. So especially in the past, we've seen HRT, antibiotics, and even insulin. But we've tackled this by building stronger relationships with more wholesalers, but also exploring AI-driven stock management tools. So that will help us sometimes forecast the demand better, allowing for a quicker response. So that will involve, web-based chatbots to alleviate the pressure on the workforce, AI stock control, but software within our own patient and medical record system.
You mentioned AI. This is very interesting because this is one of the themes that I wanted us to explore as well, is
Yeah.
kind of the digitization of the ways of working. As I'm going to my local pharmacy, so my CGP, he might give me a prescription. I go to my next door pharmacy and they already have the prescription ready and I can collect the product. But what does digital kind of transformation or digitization of your business looks like? And then we'll touch upon AI a bit later on, but the
Mhm.
digitization effectively is the foundation for everything that you do in that space. So what it is, what the whole idea is for you, what it does, how it works, and how you are kind of leveraging this for the benefits of the operational effectiveness.
So we're using that software where we can. So across the 10 branches, we'll use that to have stock management. So we make sure that that is correct and accurate at all times. So we have full oversight of all of our branches. Having web-based chat platforms that will help us alleviate the pressure of our workforce because they'll be able to answer common questions that patients may have. And also, it's fast. The responses are fast. You can track the communication easier. So overall, I think that's helping alleviate the pressure that we're experiencing currently in the sector.
So is that the AI that you mentioned? Does it help you with both? I mean, you mentioned the forecasting, so obviously
Yes.
kind of AI based models that help kind of anticipate various things given
Mhm.
historical patterns. But does it also help you with the chat, or chat is a bit more prescriptive, or how does the AI augments or helps out your colleagues and the business?
It helps with the chat, but obviously we don't want to be using AI too much in pharmacy because there's a lot of patient-sensitive data, so we need to be careful in what aspects we use that. So in terms of ordering, stuff like that, we'll use that where we can for stock management mainly.
Okay, so yeah, stock management, stock keeping. So it is essentially. Do you see that as potentially replacement of some of the functions or some of the activities, the technology, or it is more of a improvement of productivity of colleagues that's already on the?
It's an improvement of the workflow because we can't. The staff are very well trained, so they're able to identify problems. So if it comes to receiving stock, staff are trained to check over batch numbers. Expiry dates to make sure the medicines are safe and secure when we receive them, to make sure that we maintain compliance, and that's not something that can be easily replaceable.
Okay. Looking forward though, so we talked about AI and what you do today, but looking forward, not necessarily AI, but kind of overall, where do you see kind of the evolution of the tech and how it could be helping out you more or further? So either there's some projects or programs that you're already running, or you're planning, or you're thinking about in specifically in operational space. So what the future looks like.
Yeah, we use automation a lot in pharmacy. We're seeing a lot of them going to hub and spoke models that they use robots for dispensing. We have patient collection machines where there's essentially a vending machine for patients to collect their medication. So we use it in some aspects, and I think maybe further down the line it will expand a bit more, but I don't know how far we're going to go with that.
Yeah, I know dispensing machines are actually very, very helpful. I mean, I'm using one myself where, the pharmacy is closed at 6:30 or 5:30. Actually, 5:30 in my case, but I can go at 11 when I'm walking my dog, for example, to collect the prescription, which is very helpful. So with regards to so you mentioned robotics for picking and the last mile. So last mile is actually quite an interesting area as well, and not every pharmacy or even the pharmacy networks actually do kind of home deliveries and last mile. So how do you see that area of operations? Maybe what are the specific challenges that you guys face there? Do you do it all yourself, or do you use logistics partners that provide you with the actual delivery capabilities? So how do you run that?
No, we run all of the delivery and all of the operations ourselves, and we have delivery drivers, but we use software which will optimize the route so they're not wasting time, and it's planned specifically on the postcode.
Okay. Do you have enough volume to actually keep your drivers kind of well occupied? Because obviously, demand is just your demand, and that's sometimes the routes could be very kind of sparsely populated, so the route density could be low. So the driver could be on the road for 6-8 hours, but they're only going to have 2 drops. I appreciate that it could be a life important medication.
Yeah.
But if we're looking at economics at this, so how do you match up the economics of sometimes not necessarily or having the drops being delivered too expensively versus maybe outsourcing this? So have you considered that, or is that a compliance issue as well? You can't work with outside partners.
We're very fortunate where we don't need to outsource yet. We manage it based on the area and the population, the demographics. So if we 1 week, one area, they don't need the delivery driver 5 days a week, we'll drop that to what that area needs. So it's all area specific. We've got one area where they have a delivery driver 5 days a week, but another delivery driver, they'll just do 3 days a week. So we're flexible. We forward plan that, so there's no time wasted.
You are listening to Chain Reaction. This podcast is brought to you by Phlox, the leading marketplace for the supply chain and logistics industry. Visit phlox.is to find out how you find the perfect supplier or make your services available to prospective buyers. Thanks for tuning in. Now back to the show.
Okay. So it's like you have, for example, like milk rounds on Wednesdays. I'm doing this bunch of postcodes, and whatever needs to be delivered on those, I'm just going to deliver them. Right.
Yeah.
Okay. Okay. Well, that's interesting. We have a partner who does something similar, but they are not obviously in the pharma business. So they deliver kind of consumer goods. And what will stop you? And that's an interesting, just entrepreneurial thoughts. What stops you from potentially delivering more than your own range and then deliver some, I don't know, groceries, for example? Because I mean, I can imagine that the vans or whatever the vehicles that you're using are actually not carrying physically a lot of loads. It could be
Hmm.
many stops, but physically it could be, I don't know, a couple of baskets and that's it. And then, I don't know.
Yeah. Yeah, I think there's so many platforms out there already where we don't need to branch into different sectors. You know, the platforms that they've got, I think they're well managed. We'll just handle medicines.
No. It's an interesting point. Because I mean, I'm coming from the point of me being kind of a consumer. Even when I order a bunch of things on Amazon, I might have 3 deliveries a day, which infuriates me. Because why can't you deliver it in
Yeah.
one go? Why do I have to run up and down multiple times a day just to open the door for yet another box? Okay.
Yeah, that is a problem that we experience as well. People having multiple deliveries throughout the month. So we try to have them on one drop so they're not, because it's frustrating. I understand if you're having a delivery once a week, no one wants that. They don't want to be waiting around for that. So we try and put them all together. Yeah.
But how do you deal with urgent delivery? So, for example, somebody needs antibiotics tomorrow or
Mhm.
ASAP, and the milk round is not in that area tomorrow. So, how would that be delivered?
So we'll just use a driver from a different area. We're very adaptive. A member of the staff will go and
Are
deliver it if
you
needed. If they
okay?
sense that it's urgent, yeah.
Okay,
Medication or antibiotics, yeah, we don't want them to go without them.
okay, okay. No, I'm still trying to understand whether the use of own drivers is an economic decision or is a customer service decision.
I
Uh,
think it's nice to have a friendly face. These people are service users. They've been using us for a very long time. We're trusted. Pharmacies are very trusted individuals. So people, they want to be seeing that regular face as if they were visiting the pharmacy. It's the same regular faces.
Okay, no, very very interesting. Okay, so we sort of explored the downstream side of the logistics, and again, if we're still on that digitization sort of
Mhm.
theme, but we go upstream, we go to your suppliers and wholesalers that you work with. So
Yeah.
how collaboratively you're working with them, how the relationships are working, and how well digitized the relationships with them are, how collaborative they are,
Yeah.
and or archaic for that matter. So
We have very strong relationships with our wholesalers, so we were able to preempt any changes in the markets. They're able to give us insight of that. We also have a wide range of wholesalers, whereas other groups they may only use 3 to 4. We use about 10 to 12, so we're able to outsource from a wide network.
oh, so essentially, yeah, you use a potentially multiple suppliers,
Yes.
even for the same category of products, just to make sure
Yes.
that you have so they are helping you with effectively creating a resilience. Are they not requiring exclusivity of some sort, or at least demanding certain volumes? In order to help you with good pricing, or this is a conscious decision to make sure that you're never out of stock on any particular item.
No, no, that's normally a trend if you have a big spend. So, larger, smaller groups, they need to build loyalty to them so they don't miss out on any, if there's pricing shifts. But we don't tend to see that much as a group because we've got a wide, spend across all of them. So, we don't have to, say we'll give you this or we'll give you that. It's quite
Mm.
even, yeah. It's very competitive and they understand that as well.
Right. Okay. No, that's very interesting because one of the challenges that are very often here in the logistics space is actually trust, and the issue, or the lack thereof
Yeah.
is where either suppliers or logistics partners are not necessarily a kind of 100% open, or they are way too forceful in pursuing their own kind of selfish agenda. So how do you find that issue kind of affecting your side of business? I understand that most of the logistics you actually manage in-house. It's the
Hmm.
relationship with your suppliers that are predominantly third parties. And but how do you find the kind of the trust versus personal relationships versus transactional relationships that are building in that space?
I don't think we tend to see that much. It's just building, regular communication with them, so they trust us, we trust them. Regular meetings with our account managers, stuff like that. If we're transparent with them, so if we use other wholesalers, they're aware of that. They want to be competitive against other wholesalers. Yeah, I don't think we have challenges like that, like other
Mm.
sectors do.
Okay, well, at least that explains me because sometimes I'm getting some prescription medication and it's one brand, and then the next day it could be another brand. It's like, okay, well, that's probably, well, because some of the stuff is generic, obviously, and it's just
Yes,
okay, well, coming from different distributor of whatever they have in stock, but
yes,
the underlying the ingredients is exactly
yeah,
the same. Um, I think it would be very, very interesting to explore, and then we touched upon that earlier, is kind of the evolving role of pharmacy. So
yeah,
pharmacies that typically it's like it's sometimes they play like a corner shop in the community, so to
yeah,
speak.
yeah.
Um, but how do you see the evolving role of the pharmacy? How which kind of model is going to evolve towards more like a drugstore type, the Boots type of
Mhm.
business, like a retailer that has a pharmacy attached to it?
Yeah.
Uh, or would that be a pharmacy at its core with more kind of healthcare elements
Mhm.
being added to it? So interesting on your perspective.
So community pharmacies, I think, will shift to see them as central hubs. We're right in the heart of the communities, so patients come to us for the first point of call before going to their GP surgery. Sometimes they put a lot of trust in us. We offer a lot of services already, apart from normal dispensing, such as contraception, flu, travel vaccines.
Mm,
Key key example of this is the minor illness service that we've got now, which was commissioned by the NHS, Pharmacy First, which will allow patients to come to the pharmacy for the treatment of conditions without having to see the GP. This makes care faster and more accessible for the patient. And also the COVID program rollout was a prime example, of pharmacies delivering safe and scalable care. And that paved the way for the expansion of more clinical services. And recently, the announcement of the 10-year plan that puts a lot of
mm.
emphasis on community pharmacies as we improve access and outcomes for patients closer to their home.
No, very, very interesting. So yeah, it clearly, I can clearly see as well that the pharmacist is beginning to play a big and bigger role in the communities. Is there anything that stops you from growing or expanding on services, either legislative limitations or any? What are the challenges? What are the barriers potentially for you to expand further into adjacent areas, or maybe kind of branch out into something that is complementary but not necessarily pharma related?
I think the biggest problem that we're seeing at the moment is underfunding and staffing issues. But we've addressed this by upskilling and training our staff members that we have. That allows us to free up our pharmacists so that they can spend more time on the clinical services. And since
Mm,
COVID, we've received additional investment of 670 million from the NHS.
mm.
And this investment obviously recognises the role that we have in public health, but we're still going to require a lot more for ongoing support, and that will be used to sustain and grow the services that we already offer, and more services as we continue to, offer more clinical services.
So it's expanding. It's expanding your the kind of the personnel and the services that it offers. Is also, does it help out with a little bit of the working capital so you can carry more inventory? You can actually offer, I don't know, new lines of products and so forth. But it's still all around the pharmaceuticals, obviously. So you're not
Yeah.
necessarily NHS is helping you to expand your clothing lines.
No, so to be honest, not really. It doesn't help the day-to-day running of the pharmacy, just the service side of it.
Okay. Well, the interesting side of things is the collaboration. So we touched upon the kind of collaboration in logistics a little bit and kind of the collaborative planning. But how does collaboration across the board, maybe with either other healthcare providers or other kind of the other elements within the chain will help potentially will help the business to grow, sustain, or become more effective?
So we work closely with the GPs, ICBs, and other healthcare professionals very closely already with the shared services that we offer, such as vaccinations. But I think going forward, we need more streamlined, processes. So referrals, record sharing, ensuring them pathways are seamless ensures that no patient left in the cracks. We are building bridges between us and the healthcare system. And catching the issues early that patients are experiencing, we can provide care quicker. It's more accessible, and provide preventative care for the patients too. And again, the NHS 10-year plan recognises pharmacies and what we have to offer in reducing the waiting lists that we experience at GPs and hospitals, and boosting access for the patients closer to their home, alleviating pressure on all sectors.
Very interesting. Thank you. Well, thank you for that. Thank you, Natasha. I think there's been. I'd like to finish our podcast. I think on the theme of advice. So,
Yeah.
what kind of advice you would give, especially to the younger audience that is either joining or just started work in logistics space, not necessarily kind of pharma related, but in the logistics space, in the operational space overall, dealing with different categories, volatilities, the uncertainties, the reliability, the resilience issues, and the last miles and upstream suppliers. So all of that could be a massive head scratcher. It can be way too complex. Some people don't want to kind of dive into the firefighting mode, and they like more of a peace and calm. So how would you help them navigate this? What advice would you give them?
Don't feel overwhelmed. It probably is very overwhelming to begin with. There's loads of information coming in from different areas, a lot of data, but I think all of a sudden it just clicks, and it makes complete sense. And ask for help as well. Don't just feel like you have to do it by yourself. There's help all around.
Wonderful. Thank you, Natasha. Thank you for joining us today. It was definitely was a very interesting discussion, and it's a sector that we haven't talked about before, but it's a very, very important part of our lives. So thank you for coming. Thank you for sharing your thoughts and knowledge about this.
Me. Thank you.
Thank you.
Thanks for tuning in to Chain Reaction. We hope you enjoyed the show. Please don't forget to subscribe. If you have a story or opinions to share from your sector, we'd love to hear from you. Simply reach out to Chain Reaction or visit phlox.is for more information. See you next time.